Listeriosis is a serious foodborne infection usually caused by eating food contaminated with the bacterium Listeria monocytogenes. Listeria monocytogenes is a gram-positive anaerobic rod-shaped bacteria capable of surviving in the presence or absence of oxygen. It can grow and reproduce inside the host cells and is one of the virulent and deadliest foodborne pathogen in the world, causing 20 to 30% of foodborne listeriosis infection, which may be fatal in most of the cases. Infection by Listeriosis monocytogenes causes the disease listeriosis. The clinical features of listeriosis depend on the patient. In older patients, especially adults and people with immunocompromising conditions, the most common clinical presentations are invasive infections such as sepsis, meningitis, and meningoencephalitis. People can also experience focal infection including septic arthritis, osteomyelitis, infection of sites inside the chest and abdominal cavity or in skin and eyes. Listeriosis during pregnancy is a typical, relatively mild flu-like illness. Some pregnant women with listeriosis infection have no symptoms at all and some shows little symptoms. Although severe disease in the mother is rare, infection during pregnancy can result in miscarriage, stillbirth, preterm labor, and sepsis or meningitis in the neonate. But in older adults, people with weak immune system and pregnant women with higher age and the newborns are the highest risk of developing listeriosis. Symptoms of Listeria infection can include fever, muscle aches, nausea, diarrhea, headache, stiff neck, confusion, loss of balance, and convulsions. Why listeriosis is dangerous is that it has the ability to get into the central nervous system, which makes it more deadly. Once inside the CNS or the central nervous system, Listeria can cause an infection in the membrane surrounding the brain and the spinal cord known as meningitis, or the brain itself known as encephalitis. Both of these conditions and the complications can be life-threatening. So that's why being a food poison infection, this is the deadliest pathogen in the world. The best way to avoid Listeria infection is to avoid high-risk foods and to follow hygienic food handling techniques. Food that's a high risk for carrying Listeria infections include foods at ready-to-eat salad bars, sandwich bars, etc., ready-to-eat meals, soft and semi-soft cheeses, unwashed raw vegetables, soft-served ice creams, raw shellfish and seafoods, unpasteurized dairy products, cold and prepared meats. So avoid this kind of food to prevent Listeria infection. Don't panic. We have to remember that this infection is quite treatable if diagnosed early, and share this information to create awareness. So that's all for today. See you in the next video. Till then, take care, be happy, and stay healthy.